In this study, in medical practice, we do a lot of procedures like bringing in lines, performing biopsies, bone marrow biopsies, liver biopsies, kidney biopsies. And one of the things we struggle with is to what platelet level this is a safe procedure. And there have been multiple studies to test whether a certain level, certain level of platelet count is safe to perform such a procedure. And what we did now is that we did a systematic review of all the studies that have been performed for these procedures, and tried to find whether we could find a good level which might be safe. And when we looked at all those different studies, there were two things that were very remarkable. That the bleeding was very, very variable. It was a factor 10 difference between the same studies, in the same procedure, in the same kind of patients. So we looked what the cause of that was, and the reason for that mainly is that all these studies use different scores. They have different reports of bleeding, they have different definitions of bleeding. So what we actually tell with this abstract here at ASH, or this talk at ASH, is that if we really want to find a safe level for platelet transfusions, we have to use a uniform way to define bleeding and to use the same methods to measure bleeding. And that's actually the message we will bring today, or no, Saturday. Yeah.